Hi, Mr. Geary. I'm Cassie. I'm a PA student. I'm going to be taking your history. Can you explain to me why you're in here today?
Yeah, so over the past few weeks, I've noticed like a blurry spot right in the middle of my vision. It's just a nuisance.
Yeah, that sounds like it'd be annoying. It's just a blur set right in the middle?
Yep.
Alright. And how long would you say that's been there for?
Started about a few weeks ago. 3
weeks.
weeks.
Okay. Well, since it's our first visit, I'm going to ask you some more questions so we can get to know each other better.
Alright.
So what is your age?
53.
53. And what gender do you identify as?
Male.
Male. And your ethnicity?
Caucasian.
Caucasian. And what is your occupation?
Homicide detective.
Oh, wow. That is very interesting. And prior to this blurry eyesight, how is your general health?
Pretty good.
Good. And your marital status?
Married.
Married. And have you had any significant past medical history?
A broken ring finger, and had pneumonia when I was young, and asthma when I was younger.
Alright. And when did you break your finger?
When I was 16.
16. And pneumonia, how old were you around?
8.
8. And then asthma, do you still have the asthma now, or is it gone away?
It's gone away.
Gone away, okay. And when did you first develop the asthma?
I had it like all growing up, and
Alright.
I grew out of it when I got around like 18.
Okay. Alright, so back to your blurry vision. You said it started about 3 weeks ago?
Correct.
And would you say it gradually gotten worse? Or?
Yeah, it gradually got worse. So it was like small at first, and the blurry spot is like getting bigger.
Okay. Were you doing anything prior to this getting worse or developing?
Going about my normal daily life.
Just normal?
Yeah.
Just kind of came about?
Yeah, first time I noticed it, I was reading the newspaper.
Okay. Do you do anything that makes it worse?
No, nothing really makes it worse. Just.
Does anything make it better?
Nope.
No?
Tried squinting my eyes.
So squinting doesn't do anything?
No.
Has anything changed since the onset? You said gradually it's getting larger.
Yeah, it gradually got larger.
And have you experienced any different symptoms or new symptoms?
No.
No?
Nothing else.
Have you had anything like this before?
Never.
Never?
Never had any problems with my vision.
And do you have any pain associated?
No pain.
No pain?
No.
Okay. And where would you say it's located? You said in the center of the eye? Does it deviate at all, or just right in the center?
Not really. Just anywhere I look, it kind of seems to be right in the middle of my vision. Like your face seems kind of blurry.
Okay. Has it changed at all? Other getting worsened? Does it get better in the morning, at night?
Nah, I wake up in the morning and it stays consistent throughout the day.
Consistent.
Just over the past 3 days or 3 weeks, it's gotten bigger.
Okay. So, do you wear any glasses or contact lenses?
Nope.
No. And when was your last examination of your eyes?
10 years ago.
10 years. Oh boy. And you said there's no pain associated?
Yeah, no pain.
Have you noticed any redness?
Nope, no redness.
Have you been like tearing a lot?
No.
No. Do you see double vision or just meaning blurred vision?
No double vision, just blurred vision.
Okay. Do you see spots?
No.
Do you see any specks?
No.
Flashing lights?
Nope.
How about, have you had a history of glaucoma or cataracts?
No history of either.
Okay. Have you noticed any recent weight changes?
No.
No? Your pants fit any tighter or looser?
Nope.
No? Have you experienced any fever?
Nope.
Weakness?
Nope.
Fatigue?
Not really.
No?
Tired, but just from work.
General?
Mm-hmm.
Yeah. Do you take any medications?
I take desvenlafaxine and succinate.
And what dosage?
50 milligrams.
For the Lax?
Yes.
And how much for the other one?
Well, they're the same medication.
Oh.
There's no effects in sucanate. Just 50 milligrams orally.
Take it orally, and how often?
Just one time a day.
Have you had any recent dosage change?
Yeah, it was doubled maybe 3 months ago.
Okay. And do you have any allergies?
Amoxicillin, penicillin, Vicks Vapor Rub, and cats.
And how does your reaction look like with the amoxicillin?
My mom told me with amoxicillin and penicillin, it was just like a overall rash.
Rash. And when did this occur?
When I was young, a baby.
Both of them?
Yeah.
Okay.
I haven't had them since.
And then how does the vapor rub?
I get a red rash on my chest.
Is that where you apply it?
Yeah.
On the chest. And when has this occurred last?
When I was 17.
17. And how about the cats? How does that look like when you get a reaction?
My eyes puff up and get red. My nose gets congested. My throat gets itchy.
Okay. And when did this last happen?
About a week ago.
A week ago. Do you have cats?
Yeah.
Yeah. Now I'm gonna get a collection of your past medical history.
Alright.
So how's your overall health as a child?
Pretty good.
Good?
Just pneumonia and asthma.
Do you notice any other illnesses that you have in your child?
No chicken pox, and I had strep throat when I was younger a few times, and mono one time.
And how did these resolve?
Strep, whenever I got it, I just got a medication, and Z-Pack, I think, and mono, I was sick for like 3 months.
Okay. And when did the mono occur?
I was 20.
20. Okay. And do you have any other complications with the pneumonic?
Nope.
No.
No.
Did you have measles when you were younger? No. Rubella?
Nope.
Mumps?
Nope.
The whooping cough?
Nope.
Chicken pox, you said no. Rheumatic fever?
Nope.
Scarlet fever?
Nope.
Polio? Nope. Diphtheria?
Nope.
Okay, now I'm going to get your health now as an adult. Have you had diabetes?
No.
No. Hypertension?
No.
Hepatitis?
No.
HIV?
No.
COPD or asthma?
No. Well, asthma when I was younger, but not as an adult.
Okay, so it's gone now.
Yeah, it's gone now.
Any thyroid disorders?
No.
Coronary diseases?
No.
Cancer?
No.
Kidney disease? Or any blood clots? No. So do you have any illnesses as an adult now?
No, I haven't been sick in a long time.
That's good. Have you had any hospitalizations?
No, I haven't had any hospitalizations.
Oh, lucky
First
you.
time coming in for my eyes right now.
Oh. How about any accidents or injuries?
No.
No?
Accidents or injuries.
All right. And any surgeries?
When I was 16, for my finger.
Oh, yeah. And do you know what hospital surgeon?
Nope.
No, that's fine.
Towson Orthopedics, actually.
Oh,
Towson Orthopedics in Maryland. Don't know the surgeon's name.
That's fine. And you said it was a broken ring finger?
Yep.
And you were 16?
Yep.
And what was the outcome of the surgery?
They put two pins in my finger and had them in for about a month. Took them out and I had a full movement and feeling in my finger.
Perfect. So you have no complications?
None.
Awesome. Have you had any previous contact with psychiatric services for any reason?
Yeah.
Yeah. Did you receive a diagnosis?
Just anxiety.
Anxiety. And who made the diagnosis?
My PCP and a psychiatrist together.
All right. And at what age were you diagnosed?
16.
Have you gone to any follow-ups?
No.
Have you ever thought about self-harming?
No.
And have you ever been admitted for a diagnosis for a psychiatric reason?
No.
So for like a sexual history, have you had any history of STIs?
No.
No. And are you sexually active?
Yes.
Yes.
With my wife.
With your wife?
Just her.
And do you use any forms of contraceptives?
No.
No.
Too old for that.
Okay. And have you received immunizations?
Yes.
Yeah. So have you received the tetanus?
Mm-hmm.
Yes.
Yeah, like 5 years ago.
About pertussis?
No.
Diphtheria?
Probably.
Polio?
Probably. All of
MMR?
these when I was young.
Yeah.
Yeah.
The MMR, yeah.
Mm-hmm.
Influenza?
Yeah. Got that this year.
Good. Ahead of the game.
Mm-hmm.
Varicella? For the chickenpox?
Yeah, I
Yeah.
had that.
Hep B?
Yep.
Pneumococci?
Yep.
Herpes zoster?
Yep.
Meningococcal? Or the meningitis vaccine?
Yeah.
And HPV?
Yep.
Okay. Have you had any reactions to any of these immunizations? No. Good. Have you received tuberculosis test for screening?
Mm-hmm. Yeah. Came back negative.
Have you received a fecal occult blood testing?
No.
No.
Mm-mm.
A colonoscopy?
Yeah, got
Yeah.
that done.
When did you get that last done?
Like 4 years ago.
4 years ago. Have you gotten any cholesterol testing?
No.
A prostate or testicular exam?
Yeah.
Yeah. When was the last time you got that?
4 years ago.
4 years ago. Have you gotten a DEXA scan to measure bone density?
No.
How about a lung cancer screening?
Nope.
No. So we're going to take a family history now.
Alright.
So can you tell me anything about your family?
Yeah, my grandfather has hypertension and diabetes mellitus.
Is that on your mom's side or your dad's side?
My dad's side.
Dad's side.
Yep. And he has he's obese.
Please.
That's about it.
Okay. And how about your father's mother?
She's healthy.
Healthy?
No issues.
And are both of them alive or?
Yes.
Yes. Lucky duck.
Mm-hmm.
How about your father?
No health issues.
And your mother?
No health issues either.
Oh, good. And
She has she does wear glasses though.
Glasses?
She has bifocals, yeah.
Okay. And how about your mother's father?
He had macular degeneration and intestinal cancer.
Okay. And your mother's mother?
She's healthy.
Healthy. And are both of them still alive?
Yeah, both of them are still alive. Or my mother's father actually passed away.
Okay. And what did he pass from?
The intestinal cancer.
Intestinal cancer. And what age was that?
78.
78. And do you have any siblings?
Yes.
And how are their healths?
They're good. No
Good.
issues. Yeah.
Good. And what are their ages?
55, 43 and 48.
And you have brothers, sisters?
The youngest is a brother, the next youngest is a sister, and the oldest is a sister.
Okay. And do you have any children?
No.
No children? Okay. So, do you have any family history of headaches?
No.
Seizure disorder?
No.
Stroke?
No.
Mental illness?
Yes.
Suicide?
No.
Substance abuse?
Yeah.
Thyroid disease?
No.
Coronary artery disease?
No.
Hypertension?
Yes.
Okay, yeah, you said that grandfather. Elevated cholesterol levels?
Yes, with him as well.
Okay. Diabetes?
Yep.
Asthma or lung disease?
Myself.
Yourself.
And, yeah, just myself.
Tuberculosis?
Nope.
Renal disease?
Nope.
Arthritis? Symptoms? Sure. History of cancer?
Yeah. My mom's father had
Had
intestinal
intestinal.
cancer.
Or any genetically transmitted diseases?
Nope.
Okay. So I want to learn a little about your social history.
Alright.
So where were you born?
In Maryland.
In what city?
Bell Camp.
Okay. And what was your childhood like?
It was good.
Good.
Yeah. Had lots of friends, played sports.
What sports do you play?
Soccer and lacrosse.
Oh, that's fun.
Mm-hmm.
What was your last year of schooling?
A long time ago.
Like, did you
Maybe-
graduate
oh,
high school? Did you go to college?
Yeah, I went to college.
Okay. How long did you go to college for?
4 years.
4 years. You got that bachelor's?
Yep, got a criminal justice degree.
Yeah. So you're a homicide detective.
Mhm.
Does that come with many stresses? How do you relieve your stress?
Yeah. Talk to the people at work about like what's been going on and what we see, and we often go out and get drinks and take smoke breaks. And
Do you ever feel that it becomes too heavy sometimes?
no.
No? And you're currently still a homicide detective? You're not retired? No? Alright. And what's your home life look like?
Just me and my wife.
You and your wife?
Got a couple dogs and that cat.
At cat.
And then, yeah, that's about it.
Yeah. And what type of house? Do you live in a house, an apartment?
Yeah, we live in a single family home.
Single house. Do you have any stairs?
No, it's a rancher.
Ranch. I like ranches. And it's just you and your wife?
Yep.
And you said 2 dogs in there? And that cat.
Mm-hmm.
Do you have any history of smoking?
Yeah.
And how often would you say you smoke?
About a pack a day.
Back a day? And how long have you been smoking for?
30 years.
Okay. Do anyone else in your house smoke?
My wife doesn't smoke either.
Okay.
She doesn't smoke.
Do you feel safe at home?
Yep.
How do you get around? Do you drive a car, take the bus?
Drive a car.
Drive a car. Have you had any significant stressors in your life?
Not really.
No.
Nope. Just going to work. Used to that.
That's good. Have you ever served in the military?
No.
How would you describe your financial situation?
Comfortable.
Comfortable. And what do you like to do in your free time?
I like to go fishing and hunting and go on walks with my wife. And
Do you go down to the park ever?
Yeah.
Yeah.
Yeah, we do that.
So, are you able to get around the house pretty well and take care of yourself?
Yep.
Like, think you can bathe,
Yeah.
dress yourself, go to the bathroom.
Yep.
You know.
Yep. No problems with that.
What are your religious and spiritual beliefs?
Catholic.
Catholic. And do you exercise?
Yep,
How often do you exercise?
2 times a week.
Okay. And what is your usual daily food intake?
A lot of steak.
Steak.
Yeah. And a lot of chicken, pasta, rice,
What does your typical breakfast look like?
coffee, bagel, or coffee and eggs.
All right. And how about lunch?
Turkey sandwich,
Ooh.
or we go out to eat with the guys at work. That's about it.
That's it. And then dinner, you have the chicken and the steak. And
Yeah.
Do you have any food restrictions?
Nope.
And what about your usual daily food intake?
Drink a lot of water
On water.
and coffee. That's about it.
How many cups of coffee would you say you have per day?
2 cups.
2. And what are your sleeping habits like?
Try to get to bed as early as I can, like coming out of work, but they wake me up a lot for work.
How, like on average, how many hours a night would you say?
Probably like 8 hours.
Okay. And for some safety measures, do you typically wear a seatbelt in the car?
Yep.
Do you use sunblock?
Mm-hmm.
Do you have smoke detectors in your home?
Yep.
Do you have locked cabinets for medicine or chemicals?
No.
Do you use any other alternative healthcare practices?
Nope.
Like herbal medicines, or like yoga, chiropractor, medications?
Mm-mm.
So I was taught to ask all my patients about their sexual orientation and practices. Are you sexually active with women, men, or both?
What?
You said your wife. And you say just your wife?
Mm-hmm. Don't think she would like anything other than
I don't think so either. And you said you don't use contraceptives.
Correct.
Okay. And you smoke a pack a day for the past 30 years.
Mm-hmm.
And how much alcohol do you typically drink?
Couple beers a week.
A couple of years. And like a typical beer you'd buy at a...
Yeah, like
Bar.
a bottle of beer. Yep.
Alright. Do you use any street or illicit drugs?
No.
So no cocaine, marijuana, heroin?
No.
Have you ever used illicit drugs?
Never.
Have you ever used drugs that were not prescribed to you?
No.
And do you ever take more than the prescribed amount of your prescription?
No.
Okay. Because violence is so common with people's lives, I ask all my patients this. Do you ever feel like you've been physically or emotionally abused by your wife?
Never.
No.
She's a good woman.
You feel safe at home with your partner?
For sure.
Good. Okay.